lot of us suffer from seasonal allergies, especially with all the pollen in the air. Here to share his top tips with us, we have allergist Coyle from King's Daughters Medical Center. Ty, this is a very timely topic right now. I think we're all doing a little extra sniffing and sneezing.
Yeah, thank you, Susan. We're into pollen season right now. Typically, beginning of spring is when trees are going to start pollinating, and then as we go through spring and summer, grass will pick up, and then into the fall, weed pollen, especially ragweed, is going to be predominant.
So what are some of the common symptoms of seasonal allergies, and how do we know if our symptoms are from allergies or a cold?
Yeah, that's a great question. A lot of the symptoms are similar between both processes. So with both, you'll see things like nasal congestion, runny nose, sneezing, throat irritation, but more so with a cold, which is typically going to be induced by a virus or infection. You're going to have other whole body symptoms, so things like fevers, body aches, muscle aches, can have nausea, fatigue, loss of appetite, and typically the symptoms are going to run their course in about 7 to 10 days for most folks. Whereas when you're dealing with allergies, it's going to be more focused on the symptoms that I mentioned, so nasal congestion, runny nose, sneezing, and on top of that, you can have throat irritation, which with allergies, it's going to be more due to drainage from your sinuses or your nose. And then you can also have itching, which you typically won't see with an infection. So itching of your throat, your ears, itching and watering of your eyes. You can even have rashes, urticaria, or hives with allergies. And then for patients that suffer with asthma or eczema, these can be exacerbated this time of the year as well.
Okay, so can seasonal allergies be cured?
So that's a great question. No, in short, they cannot be cured, but you can, there are treatments that can help allergies go into remission, specifically allergen immunotherapy or allergy shots. So in a nutshell, allergy shots are a personalized treatment that is made based on after you have allergy testing, the specific allergens that you're sensitive to are used to make a personalized treatment for you that basically over time gives you tolerance to those allergens, can greatly reduce symptoms, and in some people actually resolve the symptoms for a long time.
What's a good way to find out what we are allergic to?
So typically allergy testing would be the best way to do that. Seeing an allergy specialist, you can have either blood testing or skin testing. Skin testing is typically going to be a little bit more accurate, but both are good.
Talk to us also about the best way to kind of control the sniffs and sneezes. What do you recommend? Any kind of over-the-counter medication?
So I would say with all environmental allergens, that be seasonal allergies or perennial allergies, prevention would be the best medicine. So determining what specific allergens are causing your symptoms and taking measures to reduce your exposure to them. Then specifically with medications, it depends on the symptoms. If your symptoms are primarily nasal, so congestion, runny nose, and drainage in your throat, I'd recommend a intranasal corticosteroid like a fluticasone or Flonase. Also, a nasal sinus rinse, if you prefer no medication, that'd be a good option, like a neti pod, or over the counter you can get Neomeds, a common brand. Those can be very effective, especially for post-nasal drainage. And then if your symptoms are maybe a little less of your nose, a little more issues with your eyes, a little more itching overall, antihistamine, I'd recommend specifically a second-generation antihistamine, so that would be like a Zyrtec or cetirizine or an Allegra or fexofenadine.
Okay, so when do we know, or at what point should we come in and see a physician and contact our doctor about our allergies?
So I'd say I'm a little biased in that regard, but I would recommend that if you are suffering with symptoms that you feel like could be allergic in nature, it is a good idea to see an allergist, be tested, and at that point you can get some more information on what may be causing your symptoms, and at the very least, learn some preventative measures that can help reduce symptoms.
Yeah, well, thank you so much. These are great ideas and great reminders for us to help us get through our seasonal allergies this time of year.
Thank you so much for having me.
All right.